morning, everyone.
Good morning.
Welcome to United Hospital, Jayanagar. Since it is a month of cervical cancer awareness, January, we have with us Dr. Pavan Prasad, consultant surgical oncology, and we'll be discussing about cervical cancer awareness today. Welcome, sir.
Okay.
What is cervical cancer, sir?
So, cervical cancer is the abnormal development of a tumor at the lower end of cervix. So, cervix is the lowermost part of the uterus which connects the uterus to the birth canal or the vagina.
Sir, what constitutes cervix?
I would like to show a picture of the same. So, if you can see, this is the pictorial representation of the female genital tract. There are two ovaries, fallopian tube, uterus, and the birth canal or the vagina. As we can see here, this is the lowermost part of the uterus, which connects the rest of the uterus with the birth canal. So, this is the part which is visible through per vaginal examination.
Sir, where does the cancer occurs in cervix?
Cervix has two parts. One is called the ectocervix and the other is called the endocervix. Ectocervix is the part of cervix which we can see when we are examining. And endocervix is the part which opens inside the uterine cavity. So in between these two parts, we call it the transformation zone. It is the most common site for development of malignancies.
What are the risk factors of cervix cancers?
Cervical cancer is associated with many risk factors, the most common ones being poor genital hygiene, multiple sexual partners, repeated sexually transmitted infections, and smoking, alcoholism also contribute to increased risk of cervical cancer, and also human papillomavirus infection, which constitutes more than this 90% of cervical cancer cases. It is the most common etiology, human papillomavirus infection. So these are a few risk factors which can lead to carcinoma of the cervix.
What is pap smear, sir?
It is a screening test to detect any abnormalities in the cervical lining. So it is done through a speculum and a brush. Ideally, every lady after the age of 21 years has to get pap smear done, that is every 3 years. So between 21 to 29 years, advised is every third yearly pap smear is mandatory, and beyond 30 years up to 65 years, every 5 years once pap smear along with testing for human papillomavirus. So this constitutes the screening for cervical cancer. So it is ideally done on the 8th day of the cycle onwards. So it is done, it's a simple office procedure wherein a speculum is inserted into the vagina and a brush is used to withdraw a few cells from the outer lining of the cervix and examined under the microscope. If there are any abnormalities or if the cells are looking abnormal, that can be immediately detected. This offers a very good screening test in the sense, even if any abnormality is detected at an earlier stage, it can be cured before it goes into frank cancer.
What are the symptoms of cervical cancer, sir?
Most common symptoms of cervical cancer are intermenstrual bleed, abnormal vaginal bleeding, postmenopausal bleeding, and bleeding following sexual intercourse, pain in the back, and difficulty in urination or increased frequency of urination, and occasionally swelling of both the lower limbs. These are a few common symptoms which manifest in cervical cancer.
What are the investigations to diagnose cervical cancer?
Most commonly, it is the clinical examination which stands apart. So it's always wise to get yourself examined if any of these symptoms are persistent. So your healthcare provider will examine the entire cervix through a speculum, and if there are any suspicious areas, they would take a biopsy. More commonly, they do a test called the pap smear. Pap smear or Pavan smear is a screening test for early detection of any abnormalities in the cervix. It is not that cancer develops overnight. It goes through phases. So earliest stage would be a pre-invasive lesion which progresses further to an invasive malignancy. Pap smear helps to diagnose any abnormalities, that is even before frank malignancy sets in. If there are subtle changes in the lining epithelium or the lining layer of the cervix, subtle changes can be picked up, and accordingly treatment can be proceeded.
What is HPV vaccine, sir?
Human papilloma virus is the most common viral agent which causes cervical cancer. Among the viral strains, strain 31, 34, 35, 39, 16 and 18, these are all the very virulent, highly virulent strains which are more commonly associated with carcinoma of the cervix. So among HPV vaccines, we have two types. That is, one is Cervarix, which is a bivalent, and Gardasil, which is a quadrivalent. It covers all these high-risk viral subtypes. Ideally, we have to give these vaccines to girls in the age group of 9 to 14. So it is given in 2 doses. Beyond 14 or 15 years of age, up to 26 years, definitely vaccine has a beneficial effect. Between 15 to 25 years, we give 3 doses. That is, 1 dose today, followed by the second dose after 1 month and third dose after 6 months. Vaccination definitely reduces the viral load and definitely has a role in preventing development of cancers in the future.
What is the take-home message for on this cervical cancer awareness, sir?
Cervical cancer is definitely a preventable cancer. Worldwide, India is leading among cervical cancer deaths. Probably this is because of lack of awareness or social stigma. If we come across all the cancers, it is the second most common cancer among women of reproductive age group. Like I said, India is leading among cervical cancer deaths. Close to 65,000 women lose their lives every year for cervical cancer. So all these can be controlled to an extent if people are more aware of the common symptoms of cervical cancer, so that we can detect the disease at a very early stage and definitely offer a curative treatment. So the take-home message is, any abnormal symptoms in the form of excessive vaginal discharge, foul-smelling discharge, or post-menopausal bleeding, or bleeding immediately after sexual intercourse. So these are the warning signs of cervical cancer. So these have to be immediately brought into the notice of a healthcare provider, so that the symptoms, the disease is picked up early, and definitely it can be cured if it is detected early.
Please reach out Dr. Pavan Prasad, United Hospital, Jayanagar, Bangalore, if you are facing any query or concern regarding this. Thank you.
Thank you.